Alright everybody, my name is Gabe and I'm going to be your CMA instructor for today. Now we've been going through a series where we've been talking about different routes of administration for medications, right? And so today we're actually going to talk about administering powders onto our patients, right? So first thing we're going to do, always first thing, is we want to check our MAR, check our Cardex, make sure our MAR and our Cardex match. They do, same date of birth, great. Right, I'm looking, so we have generic antifungal powder, right, with metconazole nitrate, sweet, right time. All right, now, we always do the PIG method when it comes to our medication administration, which means we're going to pull our med, initial our MAR, and then give it to the patient. So I'm going to unlock my med card. Now the med card should always be locked when you're not near it. I'm going to unlock my med card and look for Ms. Reba McIntyre's medication. Here we go, the MicroGuard powder, Reba McIntyre. Fantastic. Now I want to make sure that I'm checking to see that the medication has the correct name on it. All right. Now that I pull that medication, I'm going to sign my MAR. There we go. Sign my MAR. So there's that pull initial, and now I'm ready to go give that medication. I want to make sure I lock my cart. I want to make sure I put these away because I don't want to have patient information exposed. I also want to make sure that I grab a barrier, a disposable barrier for administering this medication. All right, when I walk into that patient's room. Hello, Ms. Reba. My name is Gabriel. I'm going to be your CMA today. All right, I need you to tell me your full name and date of birth while I take a look at your wristband, right? I'm not going to touch my patient at this point because that arm is where we're actually applying the medication because of the ringworm. Okay, good. I can see it. Great, I'm gonna wash my hands, put my gloves on. I'm ready to get going, all right? Now for this one, my patient can be laying however they would like to be laying if this is a comfortable position for them. I'm going to expose the arm that I'm actually supposed to be putting the powder on. I'm going to take this barrier and stick it underneath that arm. I know there's no arm there. We're just play pretend, right? Now, it says to liberally shake, so I'm going to open that up. And I'm going to shake liberally all over that right arm. Alright, after that, make sure I pat it down, make sure it's nice and packed in. Alright, then I pull this barrier out from underneath my patient. This goes in the trash. I cover my patient back up. Make sure they can get to their call light. Make sure that they have water at the bedside. Alright, Ms. Reba, is there anything else I can do for you? No? Great. I take off my gloves, wash my hands, and then I've already recorded a report, so I leave the room and make sure I take that medication, go back to my med cart, I unlock that med cart, put my medication away, lock that med cart, and I'm ready to go to my next patient, okay?